I'm delighted to be able to share with you some stories about successful efforts to improve the health of communities throughout Oregon. The people you're about to hear from are county and tribal public health leaders who are doing great things in their communities to help schools, work sites, health systems, and municipalities improve the prevention and management of chronic diseases with support from the State Tobacco Prevention and Education Program, as well as the Centers for Disease Control and Prevention. We hope these stories will inspire others to launch their own local efforts to ensure the long-term health and well-being of all Oregonians in the places where they live, work, play, and learn.
I'm most excited about the fact that St. Anthony Hospital, which is located in Pendleton, went tobacco-free on January 1st, 2011. We've been working with the hospital for quite some time, educating about the movement towards tobacco-free hospitals around the state and around the nation, and I was most impressed with the fact that they planned ahead of time. So we started back in June of 2010 to work on this process, and they got all the employees involved. They knew it was coming. They put big banners up in the hospital so that everybody knew that we're going tobacco-free January 1, 2011. People were able to, those that chose to stop using tobacco were able to get assistance to quit smoking or chewing, and so it wasn't just a all of a sudden thing that happened. Everybody was well prepared. So the hospital, now that they have gone tobacco-free, they serve as a great example for other businesses within the county that would also like to look at going tobacco-free, how to work with employees ahead of time, enforcement issues, and they've just been a great community partner throughout the whole process.
The biggest success was helping Metro government pass a comprehensive tobacco-free policy. They came to us to help them with the process of passing a comprehensive tobacco-free policy for all the properties. They are enacting it in phases, so their administrative offices are going tobacco-free as I speak. I believe the zoo and convention center, expo center is going to be going later in the year, maybe December, January. I know the animals are going to be very pleased with that. And I think everyone's going to be very happy. There's a new trend that's happening. Not a new trend, it's a trend that's well past its day, and we really need to help them be successful in it.
One of my biggest successes, and it was 2 years ago, was getting the tobacco-free policies for our housing on our reservation. I had been visiting one of my elders in a duplex, and the person in front of her smoked heavily, and she was complaining about it. She was on oxygen, and she said the smoke came through and it bothered her. The next year, housing became one of my BPOs. For my grant because of my interest in that, and we slowly started working towards having policies for the housing, and a lot of the people are really, in favor of it. They're glad that it's going on. They can't smoke around the playground, which was a good thing. Can't smoke around the community building. So the public places on the reservation, it's no smoking. The plank house, of course, is sacred, so they can't smoke up there either. So it's been well received. There's always those ones that don't want to be told what to do.
Our goal, overarching goal that we set for ourselves, was to increase the level of participation of businesses and wellness programs, as well as employees participating in those programs. We identified over 30 private and public businesses. 31 showed up for the action forum, and throughout that day we created really a regional Jackson and Josephine plan. And out of the 31 that attended, 27 of them are actively engaged right now, and at least 4 of them are moving forward with adopting policies to create a healthier community, as well as a healthier work site. What I've discovered in the 21 years I've been working with public health is any of the successes that we have achieved take time. And some of the bigger policies that we have achieved that will be sustainable over time has taken anywhere from 2, sometimes up to 6 years. There's a lot of excitement around the work, and And because of the selection of the key stakeholders that were involved, I think that we all get a sense that we know that we're going to be successful in achieving the goals that we selected to do. And we know as a result of that, that the bigger picture is our community is going to be healthier as a result of it.
I would say the biggest success in Deschutes County would be the use of health impact assessment as a new tool to bring a public health lens to projects or policies that typically don't consider community health in their process. What's so great about HIA or health impact assessments are that they bring partners to the table who typically do not speak to each other. So for instance, we're on our number 2 HIA in Deschutes County. Our first one was looking at the Deschutes County Comprehensive Land Use Plan for the next 20 years from 2010 to 2030 and considering how health policy may be integrated into that plan. We focused on a tiny little community north of Bend called Tumalo and took that chapter of the comprehensive plan and brought a group of people together, land use planners, transportation planners, community citizens, some other health advocates and public health folks, and all determined what we were going to recommend be health language put into this plan so that things that got people active, that created safer places to play, that gave people access to businesses, to jobs, to grocery stores would be considered when they made this long-term land use plan. And so as a result of this work, the Board of County Commissioners have actually adopted some of the health impact assessment policy recommendations that include a multimodal trail system, parks and green spaces, and safe crossings of Highway 20, which is a highway that bisects that community. So an at-grade crossing that would allow for pedestrians, bikes, equestrians to access both sides of the community. And those are now actually in the long-term 20-year Deschutes County Comprehensive Land Use Plan as policy and support statements for future growth.
I think that the health of the community doesn't really come up in very everyday conversation a lot, and so everybody was pretty surprised that Clatsop County had one of the highest rates in the state of Oregon. Everybody felt really strongly about their desire to be living in a healthy county, a healthy place. Their sense of place was really tied to this, and so because they had such a strong sense of place, that really helped motivate them to help partner with us to get the word out. In talking about colorectal cancer, to use that as an opportunity to get into these organizations is kind of the icebreaker. But then I was able to, once I'm in there, I also talked about tobacco, I also talked about obesity. So really using the colorectal cancer campaign as an opportunity to create that conversation, to create new networks, new partners, people that I hadn't met before, and that was really effective.
We had 4 community forums, and we asked 3 or 4 kind of specific questions on what the community members would like to see in their specific towns.
At the forums, we actually went to each individual main city in our county and had one for each little community. And in that, we did invite people who were part of the schools and part of the city councils, and we also invited the business people around.
We asked, what would they like to see? What would make a healthier, community? What are some of the barriers that they're currently facing? And then we also asked the question of what's politically feasible that they think could implement some type of healthier policies on the very local level.
A part of this process that we were after was to ferret out champions in each community that were passionate about some of these ideas, because we have found that we can't come in and say, here, these are really good ideas for you and let's do them in your community. We need the people in the community to say, hey, it's important to me to have a place to go to exercise and not have to walk along the highway all the time. I want this. And by having that kind of motivation in the community and helping to draw together the people in that community and identify themselves to each other, it creates a more momentum. So that's what our hope is. We've now been able to kind of find some of the people in each community that could make these changes and who are going to be passionate about it.
In 2009, we worked with the city of Woodburn in trying to adopt a healthy food options policy for their park vendors. And we were pretty successful in working with them, and the policy was actually adopted. The actual policy that was adopted by them asks all park vendors to serve at least 4 healthy food options at their park vending events. And so the community response has been very, very well received. We are now currently in the process of expanding that effort into other community events in Marion County. And so right now we are working with other representatives from City of Woodburn and trying to get them to adopt another healthy food option policy for City of Woodburn events. What made it possible is really educating your community. I think you have to get them prepared, the people that are going to be affected by the policy. There has to be a lot of education and working with the vendors, because there was a little resistance at the beginning as to whether healthy food options sell. They're there for the profit, so they want to make sure they're making money on it. And so community surveys has helped us a lot, and so that's been a way for us to find community support for the policy, and so it has been working very well for us.
We've done some exciting work with the Vernonia School District. 2 years ago, we worked on taking their bare bones state required minimum wellness policy and really comparing that to a gold standard, and creating administrative rules and personalizing it so it's something that the whole school district could really move forward with. When we started out looking at the old wellness policy, we engaged a group of students called the Teen Health Advocacy Team, and they're high schoolers who are interested in improving the health on their school campus. And so we gave them all copies of the wellness policy and kind of read through it a little bit, and they took highlighters and highlighted everything that was new to them, that they had no idea was policy or that they didn't think was really being followed. And then they made suggestions. So we heard some things unexpected, like they love their cafeteria food, their salad bar, but they didn't like the way people would get an unlimited amount of salad dressing and smother it over everything, or little things like that that you wouldn't hear unless it was from students. And so it was exciting to engage students, because I feel like we got a really different perspective than from the teachers and administrators.
We actually had the kitchen staff on there, so they were able to point out, like, yes, this is the type of healthy foods that we can get for a low cost, and it would be easy to implement. So it was really great to hear that those healthy options were affordable and that it was something that the kitchen staff could implement.
Last year was the exciting year, 2010-11, where we started assessing what was being sold at the student stores. We had students collect candy wrappers at basketball games and really kind of doing a hands-on assessment of whether or not their new school wellness policy was being followed. And then towards the end of the year, we really got to start doing some outreach and talking with the school. How can we better improve the enforcement and the following of these new policies?